We've all just lived through an incredible 15 months that none of us could have anticipated in facing a worldwide pandemic. And it's really warmed my heart to see how all of our health centers and all of our health center staff have stepped up to the plate in a Herculean effort to overnight switch from in-person care to virtual care while continuing to provide medical services, dental services, behavioral care services, prenatal care, childhood vaccinations, while at the same time responding specifically to COVID, the testing of tens of thousands of Alameda County residents, doing contact tracing for people who got the disease, and ultimately vaccinating tens of thousands of residents of our county with the COVID vaccine. Responding to the pandemic, many of the health centers came up with incredibly creative ways to effectively reach their communities. Starting with testing, some of the health centers did mobile testing. They went to long-term care facilities. They went in vans to unhoused people, really taking the service to where people are. And then when we were fortunate enough to get the vaccine, health centers already had some experience in how to do this. All of these are things we'd never really done before, but we were called upon. The health centers were called upon during the pandemic, and hopefully we'll continue to have that ability when we're looking at health screenings and other kinds of services that people will need as we come out of the pandemic.
42.
The trust that our health centers have earned in their communities is actually the most important asset we have. And we've seen this more clearly during the pandemic than any other time. One of the things that I'm most proud of is that our health centers never closed their doors. Even after that first weekend when we went into lockdown, all of our health centers knew that being in the front line for their communities meant that that Monday morning, they still had to open their doors for those patients who needed to be seen in person. My hope for the future is that we have more tools in our tool chest than ever. We have better relationships with other community organizations, stronger relationships with faith-based organizations, stronger connections to our patients, and hopefully we can take this trust we have with our patients and go back to all the health problems that existed in our communities before. Chronic diseases, the need for preventive health services, the need for mental health services, and hopefully we're going to be even better able to address those issues in our communities.